The FDA missed a deadline to ban formaldehyde in a common hair treatment. Why many salons are concerned. That plus today, Danish drug maker Novo Nordisk is off to the races with its daily weight loss pill here in the U.S. How much it could cost you in tonight's Health Watch. Novo Nordisk announced today that it'll offer Wegovy weight loss pills to self-paying patients in the U.S. for $149 per month. That price range is for the 1.5 and 4 milligram doses. The higher doses will be offered for about double the price. There are new guidelines for cervical cancer screening. The Department of Health and Human Services now says self-testing for HPV is recommended, which could lead to more women getting tested. HPV can cause cervical and other cancers. However, cervical cancer is preventable thanks to the HPV vaccine. The COVID virus is still having a big impact on the elderly in the U.S., according to a study published in JAMA, which found people over 65 make up 2/3 of COVID hospitalizations and 80% of COVID deaths. Getting vaccinated and receiving early treatment can prevent severe illness. Teens spend about 1 hour of their school day on their phones. A study published in JAMA found half of that time is spent on social media like TikTok, and the rest is spent on YouTube and games like Roblox. The study also found teens from low-income households tended to spend even more time on their phones during school hours than teens from more affluent homes. The Food and Drug Administration missed its deadline to propose banning formaldehyde in hair straightening products. A proposed rule within the agency had an action date on the last day of December. The delay is frustrating to many users of the products. Salon workers have been pushing for the ban since 2021. The FDA has missed several deadlines on this rule since 2023. The problem with formaldehyde is it increases the risk of uterine fibroids, infertility, and hormone-related cancers. The FDA says the rule is still in the works. The next step is for it to be published in the Federal Register for public comment, but the FDA hasn't said when exactly that will happen. For a closer look, go to the feature section of 2news.com and click on the Health Watch icon.